Hey, it's Birdman for Birdman on the Mountain. Time for another Pinetop Lakeside Community Shout. With me this morning, I have Allison Hephner. How are you?
Very good. Thanks for having me on the show, Birdman.
Of course. Goofy. Now I'll just point out you're my wife. There you go. So anyways, you're here obviously for the Navajo County Public Health Services District.
Yes, I am.
And you've got a whole lot of things to talk about. So why don't I let you delve into what's happening?
Okay. So for public health, one of the things that hats I hold is the community outreach. So one thing that we're working on, every 5 years, we assess Navajo County residents for the health of our community. And what that means is we bring in a contractor that comes in, and what she does is she looks and sees what type of health issues that we have. So for example, if we have high diabetes rates, high STD rates, high child, younger kids, teen pregnancy rates, whatever that may be that's causing issues in the health of the community. We come together and we get all the data that we need, and we take that data and we assess it into priorities and say, last community health status assessment, the priorities were to fix the obesity rate, put in some projects into the community that would help the obesity rate among adults and children. What came out of that is community gardens. We did more nutrition classes in schools, things like that. So again, every 5 years this happens. So we're right in the beginning stages of planning that. And so we have our first meeting January 10th. If you'd like to be invited to this meeting, I'll give my information on that a little bit later. But what we're going to do at this meeting, we have about 65 people from all over Navajo County: Winslow, Heber, Holbrook, Show Low, Pinetop, Lakeside, Overguard, all over. They come together, Snowflake, Taylor, they come together and we ask them, what do you think the health of the community is right now? What do you think is going on in the community? What do you see as maybe some priorities that we might want to address? And we get all that documentation, we look at over, and then that's what we go and we try to assess. We try to pull those numbers. Okay, how many people in this community are obese? How many have heart disease? How many have this and that? And then that comes into a whole CHA, which is the Community Health Status Assessment, which you can hold. It's a document and it has all the numbers of Navajo County and the health percentages that we have. And then we take that and we look at it and see what's ranking highest, and we develop a community health improvement plan. And from the community health improvement plan, for example, has come telemedicine that Summit Healthcare has worked on, the gardens that I was a part of. We birthed the DV Coalition, which is the Domestic Violence Coalition that wasn't used in a while. We brought that back. That came out of the Community Health Improvement Plan. So I'm actually really excited about this because we were able to identify what the issues are, make our priorities, and then implement plans to address those priorities and make the health of the community better. And that's what public health does. The cool thing about this is we have some killer partners this year. So we're working with Summit Healthcare. We're working with Change Point Integrative Mental Health. We're working with North Country Healthcare. We have Northland Pioneer College. We have Navajo County Health Services District. And then we also have the Northeastern Arizona Innovative Workforce Solutions that's come on to here. Because bad health also affects economic. The economy won't grow. If you can't go to work because you're not healthy, nothing's going to grow. So
yeah, that's kind of very important to overall healthiness of the economy as well, right?
Mm-hmm.
Cool.
Absolutely. Sorry, I took a drink of coffee. So anyways, back to this meeting, we have about 65 participants from all over, and they're the ones that are going to voice what they see in the community. They're the ones that get to say, you know what, I think that you guys should focus on this. I think that this is an issue. So if you want to be a part of that group, and you can't make the January 10th, we also have focus groups that we're going to do in North County and South County. North County, and we're in South County in the Show Low area. North County is the Holbrook area. So there's an opportunity for that where we take this information from the core group of the 65, and then we find the information, and then we take it to these focus groups and we say, what do you think? So if you're interested in any of that, you can get a hold of me, and my email is allison.hephner@navajocountyaz.gov, and just shoot me an email and say you're interested in the community health status assessment, and we'll get you involved.
And we'll, of course, link everything down below. So if you're looking for the links or like that, if you're on Facebook, sometimes the links are not all there just because of space. Same thing on iTunes. You can look at the YouTube channel. So just check out birdman.media, no comma or anything, and you'll find the rest of it Once again, Allison Hephner, continuing on. with
Continuing
stuff.
on. But wait, there's more. So another hat I wear is HAPPY. It's Healthy Arizona Policy Initiative. And what we do through that's also part community gardens, but we also have a children with special health care needs program out there. And we came together and put together the Navajo County Children with Special Health Care Needs Coalition. And this coalition is amazing. It really has some big players in the community as far as agencies, parents with children with special health care needs, and different organizations that have come together to try to address the need of this population in our community. We've discovered several objectives that we are working on currently. One of those objectives is awareness. We don't have enough awareness in our community that we have this population up here. They're not as involved in, events and projects. So we're working on increasing their involvement in community projects. We're also working on a symposium, Children with Health Care Needs Symposium, which will bring in all of the local agencies that we have that help this population, as well as some from different communities that come in. So a parent, provider, caregiver would be able to come to this. They would meet all these resources, put names and faces to these resources. They would be able to come in and talk to a keynote or watch a keynote speaker talk about certain things that would interest them. And then we would have workshops after that, this is all in the works right now. And it will be July 28th. But the workshops will be, we have one lady coming in, Dawn, from the Office of Children with Special Health Care Needs, who takes what these parents are working with, the fact that they have, medical, they have school, they have home life, they have all these different aspects of life that for people who don't have children with special health care needs are really simplified, but for them it's really not simplified at all. It's chaotic. And so what she does is she helps the parents to build a map of all the resources and everything that they use. So and it's a brilliant thing. I saw her do it, and it takes this chaotic craziness and it actually makes it manageable so parents can manage it better. And they also get to see as, wow, I take on a lot, and they get to see that. And we know that they do, but to see that and then organize it to where it's more like eating an elephant, something that makes it a little easier on them. I know it's...
You mean that bite by bite, right?
Bite by bite, yeah. Isn't that what it is? Okay.
The only way to eat an elephant is one bite at a time.
Yes. But they need as much help as they can get and as much support as they can. And this is a great thing, a great map to help them through that. So anyway, lots of cool stuff like DDD is going to be there, which is the development disability people. They will be there teaching parents how to maneuver through their stuff on the website and get a child signed up with them a little bit easier. Just tons. Again, on this coalition, we have parents, caregivers, and providers. So they're giving us information on what they need and what's hard and what we need to address. And that's what's exciting, because we're actually fixing things that will help them, instead of some coalitions that don't have any representation from the community are like, oh, well, they'll like this and they'll like this. No, we actually get to know what will help these families. And that's where I'm excited at. So anyway, this coalition is only quarterly. So the next one is in March. If there's any parents, providers, or caregivers that are interested in being a part of the coalition, get a hold of me as well. That information will be on here too. We have many agencies involved. So as a parent, if getting involved in this, you get to meet all your resources in the community as well. We have about 55 different participants. And yeah, I'm totally stoked about it. I think it's really going to make a difference in this community for these families.
Very good. And that's an important part of things that people kind of miss sometimes is children with special health care needs, and they vary anywhere from simplistic to very complex.
Absolutely.
And it's usually the stuff that's the simple or in the middle that people forget the most, because it's like, well, it's not that big of a deal, but it actually is. Yeah,
and we have a lot of, what I've learned is we don't just have autism on the mountain. I mean, we do have a school on the mountain, Lexington, for kids that have autism, and you think, wow, we have a high autism population. Well, we also have a very high epilepsy population and rheumatoid arthritis, juvenile rheumatoid arthritis, and I didn't realize that. And these are some of the things that are being represented in our community of the coalition. So it's exciting.
Okay, I see one more piece of paper. Does that mean just one more thing? Or
Yeah, that means
okay,
one
cool.
more thing.
Awesome. What else do you have there?
So now back to the community outreach, and this is also a happy part of my job. We're partnering with the Arizona Department of Health Services, and they're coming up to our community to offer this to business owners. It is a work towards better health. Basically, it's worksite wellness. And so what they're coming out and they're getting with Summit, and they're teaching a course. It's a one-day event where they're teaching evidence-based information on how to get your work site more healthy. So what kind of programs can you implement for your business that will help your employees be healthier, which will help your insurance costs go down, because all of us know insurance is super duper expensive, as we know after just having a child. So anyway, it's for January 30th from 8 to 2. And it's going to be at Summit Healthcare Center in conference room number 4. And if you're interested, we'll also have this flyer on there. So what you're going to learn about, and I'm just going to read off the flyer so I don't get this wrong. There's 3 big bullets. How to design a comprehensive worksite wellness program that can improve health of your business and employees. Successful national and local employer efforts to improve employees and organizational health. And then how to apply for a Healthy Arizona Worksite Award. So you can actually get bonus points and get an award for being that innovative and putting that stuff into your work.
Well, that's pretty cool.
Yeah. So this is for businesses.
Okay.
Business owners. Come down.
And nobody
an organization
doesn't like awards. So
no, nobody
awards
doesn't like awards.
Always good.
Well, and if you get an award for you because you give back to your employees and you help them to be healthy, that's a pretty cool award to get.
Very cool.
Yeah.
Awesome. Anything else?
No, I don't think so. I could come up with a lot more, but that's about elephant.
We'll put all your contact information down below and any of the information that they need, links and things like that. And as always, thank you very much for stopping by. Hey, want to mention to everybody, don't forget that, as we talked in Mountain Talk this week, the end of the week, which is actually the beginning of the week, sorry. So Sunday, it depends on where you look on the calendar. Sunday's the end of the week, but it's the beginning of the week. I've never figured that out. Sunday, I'm going to be at 11 p.m. down at the Festival Marketplace, which, of course, is where the Deuce of Club card guys are dealing out the cards to show low. We're going to be dropping the Deuce of Clubs at midnight, and that rings in the new year. And there's also going to be fireworks. So I want to remind the people that have dogs that get freaked out by fireworks that's going to be happening at midnight. So be aware of that Sunday night and into the year. That's not too much. They just do a couple. It's a cool little show, but it's small. It's not like 4th of July. So check that out. Come on, stop by. Or you can watch it live on Facebook. Hopefully we'll have a good connection there. Just watch here at the Birdman Media community page that's on Facebook, and I'll see you there. As I always say, if I don't see you around town, I'll catch you right here on the web.